Ever wondered what happens when you blend cutting edge orthopedic know how with a whole person approach to healing? Today, we're diving into that world with someone who's redefining what physical therapy can look like. I'm thrilled to welcome Lindsay, founder of Beyond Physical Therapy, a clinic that's not just about fixing injuries, but about helping people move, feel, and live better. Lindsay's journey from clinician to business owner is packed with valuable insights, and I'm eager to delve into her story and philosophy. Thanks for joining us.
God, it's a pleasure to be here. Thanks for inviting me.
Absolutely. Okay. So let's start at the beginning. So for those who haven't come across your work yet, can you give us a quick glimpse into how Beyond Physical Therapy came to be?
Yeah. So, really, physical therapy came to be because I saw a need in my own life in a few different ways. One was I was dealing with some different medical issues, and I have ended up jumping from provider to provider just to try to look for answers. And on the outside, I looked like a very healthy, thriving individual, but on the inside, things were definitely wrong. And so, it took a lot of work on my end to find the right person who could help me. So part of my practice is really helping these people who look healthy on the outside, but are dealing with pain, injury, whatever. And they're either really good at covering it up or it's limiting them from doing the things that really make them and make them thrive. They're getting through their day to day, but that might just be about it. So that's one side of it. The other side of it was when I was working in a traditional physical therapy practice, my schedule was jam full and I was super booked. And so if I needed to go find care for myself, I had to find people who were open after office hours or on weekends or who were super flexible. And I saw that with my patients as well, that when they were coming in to see me, that they had to block off, usually 2 times a week for 6, 8, 12 weeks. Time to commute, I'd have to find childcare, block off their work schedules, all of these things because I could only treat them between like 9 and 5. And so when everybody else is working, it's hard to get in these appointments that are absolutely necessary in order for you to help rehab. And so with Beyond Physical Therapy, one of my major cornerstones is accessibility so that, patients can, for one, meet me outside of the traditional business hours, or I have a mobile practice as well as my in-clinic practice so I can go to them. And also I'm available to them. So they all get my business cell phone number. And so if they have a question or an issue, they don't have to wait until next time they see me, or, if they're currently not seeing me for anything, that they can just like ask me a quick question about something. And sometimes I can save them coming in entirely because I just told them that, hey, maybe you need to modify this or try this stretch or, whatever it might be. So that's really where like my practice philosophy came from.
Interesting. So accessibility is huge. And I can relate even thinking just like going to the dentist or the doctor, there's always this like when you can see them and then it's like, do I have to take time off from work? Um, a little thing that I don't know if it would freak people out or something. You mentioned like giving their your number and they can call you. Do you set any boundaries with that? Like when like don't call or because obviously you want it sounds like you want to be there for them, but do you set boundaries with that?
Yes, definitely. I with the caveat that I definitely have boundaries because when you're dealing with people in pain, the last thing I
Yeah.
want to do is hanging and let them suffer.
Right.
But at this, I also do need to be a mom and a human, outside of work. So, I'll tell patients, if you call me or text me at 3 in the morning, I have my phone silenced. Like I will not answer
Yeah.
you.
Okay.
And I've had a coffee and my brain is working, then I'll do my best to contact you. But like I get lots of messages on the weekends. But even with that, if I am with my daughter, that is like us time, and I put my
Okay.
phone away. And for the most part, in an hour or two, I can pick that up, I can help answer questions. Very rarely am I dealing with like a true like medical emergency. So
Yeah.
usually, if someone can wait even just an hour for me to answer their questions, it works out fine. And my patients are generally very, very respectful of that.
Okay. Good. It's glad you shared that. Yeah. I just was like a little nervous about that, how that would lead into your own quality time and whatnot. But I'm glad that you've got those boundaries. So you've carved a unique path blending strong orthopedic experience with a whole person lens. What beliefs or lessons have most shaped how you work today?
Yeah, I think on like the belief and lesson side, my parents raised me with the philosophy that you may not always be, the smartest person in the room, and you can't control that, but you can control how hard you work and how you respond to different situations. And so when it comes my like practice, when someone is on my table in my office, I'm going to work as absolutely hard as I can to help them as much as I possibly can. I may not have all the answers. I can always go and look those up and, try to provide as much information as possible. But really, my big thing is like, I want to make sure that we are getting as much done in that time that you're here because that time is so valuable. So, really, just working as much as we can during that time. And also, when I'm treating someone, I want to make sure that like we are like hitting everything we possibly can. We're talking about some of the contributing factors to what's, dealing with their pain, like sleep, stress, nutrition, those things. Um, and then also, like, if they're doing treatment and they're not responding, I want to be able to say, look, we have literally tried everything that I know. I've been a PT for 17 years. I've seen a lot of things. We've tried addressing, the other factors that contribute to your pain, and things just aren't improving. I may not be the person for you. So then I have a broad network of other professionals that I can refer them to, or, try to take, a different approach that way. So it's really all about the like lessons in hard work and really just being there for the person in front of me.
I've heard too, like just making sure that when they go home that they're actually doing the things that they need to do on a daily basis. Do you find it challenging to say motivate or keeping them like, hey, we talked about doing these things, how is that going? Like, did you actually do it? Do you find any challenges keeping them kind of on track and doing the things they need to do?
It depends on the situation.
Yeah.
Because I don't take insurance in my practice, people are paying me
Okay.
out of pocket. And so I think that like that transaction of they literally take out their credit card when they're paying for their visit, that holds people a little bit more accountable because they literally have to put their money where their mouth is. And I joke with them that like if you don't do your things at home, like that's fine. You can just come see me for more visits and for longer, and you can fund my daughter's college. Like that's great. Everybody somehow, right? And some people
Yeah.
actually are entirely fine with that, that they just want to get the work done when they're here. They don't do what I tell them to do out there, and it just takes them longer. And we can have those very frank conversations that that's going to affect your, ideal. So they're
Yeah.
important.
Yeah. It might
So
take you a little longer.
right, right. But also like being able to like be in contact with people. So if I have a new patient, I always follow up with them within 24 hours. I tell them I'm going to follow up with them within 24 hours just to make sure like they're feeling better, they're moving better, they're doing what I asked them to do. Answer any questions they might have or anything that might come up. So there's also like that accountability side of it too, that like they know I'm going to be checking on them, so they better be, doing their thing.
Yeah, I was gonna ask, like, how are patient expectations like shifting? Like, and how have you adapted or leaned into that with your own business?
Yeah, that's a great question because that's been an interesting aspect that I've observed through not only like through the course of my career, but also shifting from the more traditional setting to more of this like private cash based kind of setting. So, when people are like paying in person for their session and not just having kind of insurance doing their thing in the background, there's that expectation that like there's results. So
Um,
people are used to instant gratification and quick results and getting what they're paying for, and also having some say in what they're getting as well. So, in that first visit, I really try to find things that we can treat and we can make an immediate difference, whether it's, their back hurts and they can't bend forward, right? So, we work on that during that session so that ideally by the end, they stand up, they bend forward, like, wow, that's way better. Like that feels much better. So there's like that immediate like turnover that's really key, but also that like I was saying before, how people want to have some say in their care. So there's the people who literally just want to come in, get work done, and not do anything I tell them at home. That's fine, right? Like that is their choice, that is their say, right? And then there's others who let's say, have a very demanding schedule. And so, instead of coming for an entire hour, we might have to do a half hour session or an hour and a half and really like get stuff done in that amount of time. So there's
Yeah.
the expectation that they have some say in how often they're coming, how long they're spending, the things that we do during the session. I do a lot of dry needling, for example. And since most of my referrals come from word of mouth, people often come in expecting that they're going to get dry needling. And a majority of the time, they do to some extent, but that's also, have that expectation. So, if they're, as long as they're medically appropriate, I'll do what I can to meet those expectations, because then that builds that therapeutic alliance. And then they get better just because they believe that treatment is beneficial.
You had touched just briefly earlier about like sometimes, if you've gone through everything with them and maybe there's a chance that okay, I need to send you out. I need to find somebody. You have this network. How has that played a part for growth for your own business? Like the community relationships or referral networks, how have they played a role in your own
hmm Yeah, that's been really um, a part of being independent, where I can choose where I send my patients, and finding other practitioners that I align with, that we have the same um, yeah, that we align with what we're looking for with our patients, that we're not trying to draw them into big unnecessary fluffy plans of care that really, aren't, specific to them, that there are other practitioners who are working with a similar population. So for one, when I refer a patient to someone else, it's almost like referring someone to a friend of mine. I can say, hey, Dr. Scott, he's an awesome chiropractor. He's going to be great for this issue in your rib that I just can't seem to get moving. I will call him. I will tell him you are coming. I'll give him a heads up on what's going on. So then when the patient walks in, Dr. Scott already knows who they are. So it really helps with moving along the care and building that trust in the next person. And also, like, I realize my scope is limited. There really is only so much that I can do. I will do as much as I possibly can, but our bodies are complex, and there's a lot of different factors that are contributing. If someone needs a more specialized like manipulation, I can send them to a chiropractor. Or, if they've been dealing with, nutrition issues and things like that, I can send them to a really great registered dietitian. Or, it just longer over time, I can send them to an awesome personal trainer who I can also tell them, hey, this is so and so. They're going to work on this, this, and this. I know this personal trainer is awesome. They're close to your house. Here, go take this.
Nice.
And it really, that care transition much better. And I learn from all of these people too. Like, I find out from my patients, like, hey, I went to go see this chiropractor. They did this, this, and this. And I responded awesome. I'm like, that's great. Now I know for the next person that comes in
Yeah.
specific issues, that maybe bringing the chiropractor in sooner might help with that whole like progression.
Yeah, I mean, I see it working both ways too, but I like that you're keeping that network and you're also looking at the feedback as well. It's like, thank you for doing that. This is what happened. And you're, like you said, you're learning from it as well. I love that. That's great. What's something you're excited to build or maybe lean into this next year? Whether it's internal growth, new offerings, or evolving the clinic's voice.
So this has been something that I've really thought a lot about. So for one thing, I love the way that my practice is structured right now, that it allows not only flexibility for my clients, but also flexibility for me. I have a 3-year-old daughter who sometimes comes home with boogers that turn into like, a nasty cold, right? She can't go to daycare. So I have to be able to take time off to be with her. So being able to have like that flexibility, and but also this like structure behind me, it just has been a great vehicle for the life that I want to build right now. So I'm really just at the moment trying to just keep this vehicle running as efficiently and as well as possible, so that then maybe if something in the future comes my way, whether kind of going back to talking about these different like referral partners that I send people to, or even like conversations I'm having with patients, that like opportunities come up, that I can say, you know what, this business is running great with me in it. And maybe there's something I can look into and explore further. So,
Sure.
like that. But also I'm definitely interested in nutrition. What we eat is what we make our cells into. When you put good fuel into a high quality vehicle, the vehicle runs more smoothly. Nutrition is the same way, right? When you put good food into your body, you are creating strong, healthy cells out of that food. And then those cells can thrive and help you heal even better. So that's something I'm a little more interested in. And I'd love to like do some more continuing coursework there just so that then
Oh,
I can
okay.
give structured advice like when they're like in person with me. I also really think like the biohacking space is really fascinating.
Oh,
So things that we can do to help improve longevity or even just take that like health like to like the next level. Like, yes, we're getting over
sure.
this injury now. Like, how can we really optimize you and turn you into like, a superhuman or like really build like that buffer, whether it's through supplementation or different modalities, like let's just say like cold plunging, hyperbaric chambers, like red light therapy, saunas, like all of that
Yeah.
stuff I think is really, really interesting. But also, as a physical therapist, I need to look at this through a number one, a lens of safety, but also like the lens of like, does the research support this? There's a lot of like really interesting, cool things out there, but like, is there actually sound research on this that this is actually going to benefit, my patients? Or is this like, I want to wait on this a little bit and see, make sure that this is actually worth like your time and your money. So, but it's really an interesting, especially now, it's just so interesting seeing what's all coming out.
Yeah, I love what you said too about biohacking, just learning more about our bodies, not even like being superhuman, but how do we get our bodies to perform the way that they're supposed to at full capacity? Or if it's lacking something, or we're not giving it the right movement or the right nutrition. If you turn that around and you're able to give our bodies what it needs and give the right movement, we'll perform so much better. And so it's it's interesting to I hear conversations about how AI is coming into the play and it's helping PTs. If you could go back and give yourself one piece of advice in, like, say, even like your first year of running beyond, what would it be?
Yeah. My biggest piece of advice would be to just trust
Mhm.
my, go with my gut instinct. There's things that I did in that first year where like I ultimately like from a business standpoint, I didn't know what I was doing. I had zero business training when I was in PT school. I knew how to be a clinician. I did not know how to be a business owner. So at first, like I was just saying yes to everything because I didn't know. Everybody comes at you with like this great marketing thing and like all these like shiny, flashy things that you think are going to grow your
Yeah.
practice to this thing, right? And then like, you have these conversations like, oh, I don't know if that's really right for me. Like, I really should have like trusted my gut and either like said, no, maybe not, or maybe not right now. So that would have saved me a lot of, for one, a lot of time, a lot of money, and I think would have been, just make it would have made that first year a lot more simple. I think learning to walk before you sprint is really
Mm.
important. I think trusting the walk before like going crazy.
Yeah. And so, like, thinking about in business terms, because you mentioned there was so much you didn't know, and I'm sure there was a lot of trial and error, failure, whatnot. Is there anything that you could think of that maybe you learned in the second year, the third year, that you wish you would have applied or you had known?
Yeah. I wish I had something really like profound and shiny to say about that. But ultimately, like my second year was get back to the basic. I had found some coaching and mentoring. That was huge.
Okay,
Um,
good.
and really like finding like a coach and mentor that like would take the time to know my practice and have that really like on one, like they really were there to help me and my practice grow. So that was a big piece of it. And with that, their big focus was like, go back to the basics, know your why and your purpose. Make sure you have your mission and your vision and your core values really pounded out because those are the things that are going to help you make decisions as you go. And when I first started the
Yeah.
practice, it was like, how can I help as many people as possible? And now
Yeah.
more of like really what do I want this practice to be and to look like and what are the things that I truly value that really helps give me a lens in order to make smarter decisions.
I love that you brought that up though, because I don't hear that enough. I feel, whereas going deeper into your why and understanding why are you doing this? Why did you come to work? Everyone's gonna have a good day and a bad day. You know, you're gonna have the good patients, the bad patients, call it, or just experiences, right? If you don't already have that why set up and being able to remind you of why you're doing this, I think that's where a lot of people are talking about it's easier to burn out.
Mhm.
Everyone gets busy, gets crazy, owning your own business and wearing so many different hats, and but being able to tap more into, like you said, your why. And I think that was great that you found a coach that said that to you. Like, go back to the basics and maybe even go another level deeper. What's it going to look like in 5 years, 10 years? What are some of those goals? So I love that. Well, is there anything else that you would like to share that you think our audience should hear?
Yeah. I'm going to put a plug in for physical therapists. Is we are,
Mhm.
my opinion, we are total industry underdogs. Not a lot of people understand what we do or amount of knowledge that we bring to the healthcare space. So now physical therapy is an entry level doctorate. So that means we're spending 6, 7 years in school. So it's a long education process. And then our goal is that once we are out, that then we can see people right away and be accessible to them and be a major player in their healthcare team. We can, in certain states, we can order imaging if we need to. We can make appropriate referrals. So, like, I love being a PT because we have like so much knowledge and so much freedom to be able to like pivot and help our patients in different ways. And one of the things that really drew me to physical therapy is that we are teaching people to use their own bodies and their own like healing powers within their bodies to get better. Most of the time, we're not using medications or other like big outside and obtrusive modalities or surgeries and things like that. We're teaching your body to use what's there and then to help optimize those systems to give the right stimulus to teach your body what it needs. We are so amazingly resilient. And I love that I have the opportunity to see that every day. And so I think, for people out there, like for when your body is amazing and it is so resilient and there's so much you can do without bringing in other things that are going to kind of muck up the system. So just, believe in yourself and believe in what your body can really do.
Wonderful. This has been great. I really appreciate this. Tell people, where can they find you or follow you?
So I have two offices in the greater Milwaukee, Wisconsin area, one in Franklin and one in Delafield. I also mentioned I do have a mobile practice as well. So I can go pretty much anywhere within like a 30-minute radius of the city of Milwaukee. So that's for in person. I also do virtual visits as well. So if anyone needs to contact me there, that is an option. Probably the best way to do that is to either call or email me. And you can go to my website, www.beyondtx, like Texas.com. I'm also on social media. On Facebook, I'm Beyond TX. And on Instagram, it's at Hello Beyond TX.
All right. Excellent. Thank you. Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparks something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.